Good evening. Thank you all again for coming. It's really a great pleasure to have you here at Jacobi, where, as she stated, I've been for the past 6.5 years. And I've really enjoyed the work I've done with the lupus patients, and it's great to see some familiar faces and to meet some new people tonight. Tonight's presentation is focused on lupus in the kidney. The run-through of the program is going to be just a general introduction to lupus. Then I will speak about lupus and your kidneys, followed by Dr. Ansari, a little bit more information, and this will finally be completed with a question and answer session. So you probably know the major concepts of lupus. I don't think you'd be here otherwise. But just to review, lupus, as you know, is a systemic autoimmune disease. It affects mostly women of reproductive age. Nearly any and all organ systems can be involved. You know, anything from skin, brain, heart, lungs, and of course kidneys, as we're going to speak about tonight. And kidney involvement is one of the more common and one of the more dangerous aspects of lupus. It's a source of major morbidity and mortality. Treatments for lupus are nonspecific. Often the treatments may include high-dose steroids, high doses of immune suppressive medications, but generally these treatment medications are not specifically tailored for organ system. Both the disease itself and the treatments, as you know and may have experienced, can be difficult to manage and also potentially toxic. And lupus can affect physical and mental well-being, and all of these things become part and parcel of living with the disease and of treating the disease as a physician. So what is lupus in more detail? An autoimmune disease is an excessive overactivation of the immune system. Essentially, your immune cells are really attacking your body, which leaves it vulnerable to attack from bacteria at the same time. It's a loss of tolerance of the immune system to one's body because normally our cells wouldn't react to our own cells and we wouldn't build up these proteins in the blood that attack the cells and cause inflammation and organ damage. So that therefore is a loss of tolerance. Certain genes are more likely to occur in patients with lupus, and many of these genes are responsible for encoding components of the immune system. There also is an aspect of abnormal estrogen metabolism, which is partially why there may be more women than males who are affected with the condition. In animal studies, estrogen can worsen the disease and cause early mortality. There's a female to male ratio of 9:1 of lupus in childbearing years. It's closer to 2:1 during childhood and after menopause, suggesting, as I stated, the hormonal influence. However, it should be noted that the disease in males can be more severe, and in particular, kidney disease in males can be more severe, can be more difficult to treat. 70% of patients with lupus are females between the ages of 15 and 45, and 10% can present after the age of 60. The highest occurrence, the highest rates of lupus are in Afro-Caribbean females, and there's an African American to Caucasian ratio of 3:1. A child of a mother with lupus has a risk of lupus of 1 to 15, and 10 to 15% of lupus patients have a first-degree relative with lupus. So regarding mortality in lupus, renal disease itself does cause a worse prognosis, or it can. African Americans have more aggressive and treatment-resistant disease. Patients with lupus typically have two different causes of death, or two different aspects that we need to be most worried about and most vigilant about protecting them from. Early on in the disease, it's the disease activity and infections because of the susceptibility, because of your immune status, but also because of the medications making you at risk of infection. And later on in the disease itself, as the time course goes, cardiovascular disease, end-stage renal disease, and thromboembolic disease, meaning blood clots or emboli, are some of the more likely causes of mortality. And again, because of the understanding of these two phases of the condition, these are the things that we need to be most vigilant about when we're treating patients with lupus. Just to run through the criteria, how does somebody become a lupus patient? How do you get diagnosed with lupus? And everybody probably knows, you've heard about the butterfly rash. Basically, to make a diagnosis of lupus in a patient, we need to establish 4 out of this list of 11 criteria, so that a patient has at least 4 of these characteristics. Now, sometimes a patient may have 3, but a strong likelihood, and in that case they would be definitely treated as a lupus patient. But just in general, that's sort of the way we make the diagnosis. And you can see the first 4 on the list are all mucocutaneous, so the butterfly rash, and I'm going to go through these in a little bit more detail, but that's something important to pay attention to. So this is an image from the American College of Rheumatology photo bank of your typical butterfly rash or malar rash, where it's sparing of what's called the nasolabial folds. This area here doesn't get the rash. It may be photosensitive in that it may come out more or reoccur with sun exposure, but isn't necessarily only present at times when there's a lot of sun exposure. And patients may have it also on the forehead, typically red, can be flat or raised over the bridge of the nose and the cheeks. The discoid rash, this is another possibility for criteria for lupus. These are raised patches, and it's called discoid because they're coin-shaped, like a disc usually. Can have scaling, follicle plugging, and a lot of times it can be seen on the ear in this particular region, and also on the scalp. Patients can have discoid lesions in other places, but these are the more common, and patients will be left potentially with areas of baldness in their scalp where they had previous discoid lesions. Photosensitivity. So I sort of mentioned this a few minutes ago. Photosensitivity is a sensitivity to the sun. It's sort of a sun allergy where you may get a rash. This picture is when the woman was wearing a V-neck shirt or a crew neck, and this was the parts of her that were exposed to the sun. Oral and nasal ulcers, this is another feature of lupus potentially. Also vaginal ulcers may be a feature of the lupus. Usually the lupus ulcers in the mouth are painless, not to be confused with many other causes of ulcers or sores in the mouth that more often are painful. Patients with lupus, although this isn't one of the criteria for diagnosis, oftentimes can experience hair thinning. It may be in this region. A lot of times the hair thinning from lupus is more of a frontal alopecia, where you notice that the hairline may feel like it's going backward. So it looks like you're wearing a really tight ponytail all the time, but it's actually really a result of the lupus. And also, as I mentioned, patients with lupus can get those bald spots in those areas where the discoid rash was. Lupus patients can also experience arthritis, and this arthritis can be very painful. You can experience swelling, you can have pain, you might have stiffness in the morning. The difference between this type of arthritis and, for example, rheumatoid arthritis is that usually the bones and the joints themselves don't note that you have damage, so the x-rays would be normal. And even though on this x-ray you can see the fingers are sort of bent over towards the side of the arm, lupus patients are usually able to move their hands back to normal position, whereas a rheumatoid patient may be in a fixed position. But a large percentage of patients with lupus will have joint pain at some aspect of their condition. Neuropsychiatric lupus is a broad term to discuss how lupus can affect the brain and spinal cord, and also that can be both physical and mental, and the nervous system in general. You can see this is a really long list, and neuropsychiatric lupus really runs the gamut from anything from seizures and psychosis to depression and stroke. Some of the severe or life-threatening complications are also part of the criteria, and these are things that we'll address tonight. Cardiac manifestations can be very difficult to treat and very life-threatening. Pulmonary, whether it's pulmonary hypertension, high blood pressures in your pulmonary blood vessels, lung disease, these are all some of the more difficult and dangerous aspects of lupus. More specifically, the heart in lupus, which I think was a topic of one of these conferences last year, can be affected in many different ways. You can have pericarditis, which is inflammation of the lining of the heart. You can have a pericardial effusion, which is fluid in that sac that encases the heart. Patients with lupus also can develop what's called myocarditis, and that's an inflammation of the heart muscle itself. You may develop signs of heart failure, a rapid heartbeat, an arrhythmia, chest pain, or shortness of breath. Most of the time, patients with involvement of the heart won't actually have symptoms, but if you have an echocardiogram, you may be able to pick up some heart disease. Also, it's very important that lupus patients and their doctors discuss the fact that lupus patients tend to have a higher risk of coronary artery disease. The risk is approximately 10 times increased in lupus patients that are young and 50 times increased in lupus patients that are 30s to 40s and above when compared to their age-matched other patients without lupus. And the reason why I say this is so important to address is because it's really a reminder that despite having lupus and paying attention to all the aspects of the lupus condition, we really need to try to maintain control of the other aspects of disease that can cause coronary artery disease. So cholesterol, smoking, diabetes, high lipids, these are all things that also can affect lupus patients. And it's very important to keep in mind that all the inflammation that's going on in the body is affecting the heart blood vessels. So it's very important to note that and to try to maintain control of your other risk factors.